From CBS 4, this is Aging Independently with Christine Bartel, empowering seniors to live on their own terms in their own homes. Sponsored by Amedisys Home Healthcare, caring for your loved ones as we would our own.
Hi everybody, and welcome to our show. Parkinson's disease is one of the most common nervous system disorders for the aging. It leads to shaking and other mobility issues that can keep us from aging independently. And while medication can often reduce the symptoms, other treatments are sometimes needed. Ron has had Parkinson's for 12 years. Medication wasn't helping reduce his tremors.
Do we have a little bit of right foot tremor there? Yeah. Left foot too.
That's when he found out about Deep Brain Stimulation, or DBS. The surgical treatment places a device called a neurostimulator under the skin, generally near the collarbone. It then delivers tiny electrical signals to the brain to control movement. Ron quickly found the results can be amazing.
How do you feel?
Great.
Take a look at what Ron looked like without DBS and now with DBS. And he's not alone. Deep Brain Stimulation has helped countless people age independently just by helping them steady their hands to unlock a door or find control to walk down a hall. Doctors Kurtz and Beasley are with us now to explain more about Deep Brain Stimulation. Thanks for being here.
Thank you.
Dr. Kurtz, as you can see, this is an amazing process. Who is a good candidate for something like this?
So right now with deep brain stimulation surgery, we're using it for 4 medical conditions: Parkinson's disease, essential tremor, dystonia, as well as obsessive compulsive disorder. In Parkinson's disease, deep brain stimulation is a surgery that we want to use for patients who are having complications with medications. So a lot of times patients come in and they start on medications, and the medications work very well for our patients.
Okay.
After a period of time, though, they can start to have complications to the medications, one being that they have unreliable response to the medications.
Okay.
And so the medications don't last as long as they used to, and so they're having to take the medications much more frequently. And the other thing is that they can have abnormal movements related to the medications that they're taking, and this can be very bothersome to patients.
Sure.
So in order to get better control of their symptoms, they can consider deep brain stimulation to get better quality of life, better predictability for their symptoms.
Okay, so it's really when the medication isn't working the way it should be, or
is.
you're having side effects. Dr. Beasley, you're the neurosurgeon that puts this device in.
Yes.
Explain that to us.
So it's a 2-part procedure. The first part is the brain part of the procedure, where we implant a small, thin electrical wire in the brain, and we actually listen to the brain and watch the symptoms go away in the operating room, which is a lot of fun. The second part of the procedure is approximately 3 to 4 weeks later, where we implant the battery into the chest wall. Now the electrical system is all hooked up, and we're able to turn the patient on and program them and watch their symptoms go away long term.
That's unbelievable.
It's very exciting.
Now I know that expectations and goals are very important, and they need to match so that there's no disappointment. Tell us about that.
The symptoms that get better with deep brain stimulation are stiffness, slowness, freezing, and tremor. Symptoms that don't get better are balance problems and cognition or mental functioning. And so if a patient really wants to walk better and they have balance problems, this might not be the right surgery. But if they have tremor, stiffness, or slowness, then this absolutely could help them with their symptoms. So we have to have a very frank discussion about what things patients want to do after surgery that they're not able to do today. If we can meet those goals, then absolutely we should move forward with surgery.
And if anybody's in doubt whether they qualify, they should call.
Absolutely.
Right.
We're happy to talk to anyone about this procedure, discuss their personal situation, and get them the treatment they need.
Thank you so much for joining us today.
Thank you.
Remember, you can always go to our website for more information, to take today's poll question and learn more about aging independently by watching all of our shows. Just head to cbsdenver.com and click on Aging Independently. Be sure to join us next time for more information on staying independent in your home.
Thank you for watching Aging Independently with Christine Bartel. Sponsored by Amedisys Home Healthcare, caring for your loved ones as we would our own.
Today's Aging Independently is also sponsored by Exempla Healthcare. Get more information on their website at exempla.org.